What are cytogenetics and what does it tell us about someone's MDS?
So, cytogenetics look at the chromosomal structure, generally in the bone marrow cells. And so, before we had mutations that we would look for in individual genes, cytogenetics were really the only sort of marker or one of the markers that we use to risk stratify MDS. So, each one of us basically should have, 46 pairs of identical chromosomes or matched chromosomes. But in MDS patients and in patients with other bone marrow malignancies, pieces of these chromosomes may be rearranged or may be missing. And depending on what we see in terms of chromosomal rearrangements or deletions or sometimes additions, that can also help us to determine prognosis in a patient who has MDS.
Cytogenetics are, you know, I talked a lot about mutations in the blood. And so there's the genetic changes that occur that then drive MDS, other cancer types. In addition to that, another main player is chromosomes. So, if you think about a disorder like, Down syndrome is a chromosomal driven disorder where patients have 3 of the 21 chromosome. What happens in blood cancers is in the blood itself, not in all of the chromosomes, but in the chromosomes in the blood itself, there is either a loss or gain that can occur. And, sometimes it's multiple losses even. But these chromosomal changes that occur drive, better risk sometimes or worse risk. And cytogenetics, or what we also called karyotyping, is basically the way that we look at a patient's chromosomal makeup to be able to get the information that we need to then make therapeutic and prognostic decisions.